Hi everyone, welcome to BioGenie, a podcast where science meets everyday life. Joining me today is Dr. Kartik Parikh, a dentist who specializes in orthodontistry. So, welcome to the podcast.
Hi, thanks for inviting me for the podcast.
Dive into today's podcast. So, firstly, let's start at the beginning. For our listeners who aren't familiar, can you explain the difference between a general dentist and an orthodontist?
Sure. So basically, general dentist is someone who has completed the 5 year course of graduate. They undergo 5 years of training, that is 4 years of academic training and 1 year of internship, where you are well versed to do all routine dental procedures. Whereas an orthodontist is someone who has undergone these 5 years of training, and apart from these 5 years they undergo additional 3 years of training in the specialty of orthodontics. So basically an orthodontist is a specialist who deals with the correction of irregular teeth, growing jaws, procline teeth.
Okay, interesting. Adding to that, what are some common myths or misconceptions people have about braces and orthodontic treatment?
I have seen various kind of patients and who have so many myths. And the most common myth that I have come across is braces are too painful.
Right.
Trust me, braces are not that painful. The initial 2 3 days, you will feel that there is something new which is inside your mouth. From the fourth or fifth day, everything will be back to normal. When the orthodontist changes the wire or activates the wire, it can cause some discomfort or a minute pain, that too for a period of, let's say, a day or two. So braces aren't that painful as perceived by the many of the patients.
So I think that's interesting, and I think many of the viewers will also benefit from knowing that.
In fact, another myth that I have come across is that only teens can go for braces. Okay, lots and lots of adults can go for braces treatment provided they have the right healthy bone and periodontium to support orthodontic treatment. So if an adult has healthy bone, healthy gums, they can definitely go for orthodontic treatment at any age.
Okay, so that's good to hear. So listen up, my viewers. Age is just a number. You don't have to be worried about any pain or any sensation. Even if you're not a teenager, you can still go for braces if you need them. We hear a lot about early intervention these days. At what age should a child ideally see an orthodontist, and what are the benefits of starting its treatment early?
Yeah. So according to the American Association of Orthodontics, the right age to visit an orthodontist is after the age of 7 years. After the age of 7 years, you can visit an orthodontist. An orthodontist will decide what would be the right age to go for orthodontic treatment in that patient. Whether that patient needs treatment or not will be decided only after the consultation with the orthodontist.
Okay.
In fact, I would suggest if they visit after the age of 7 years, if they have any skeletal problem, so let's say if they have a problem with the upper jaw or problem with the lower jaw, sometimes what happens, the upper jaw is behind or the lower jaw is too much in front, which we call as prognathic mandible. In such skeletal problems, if you undergo treatment at the right age, it can such problems wherein the jaw discrepancy exists. That is, as I told earlier, the proportion of the upper and lower jaw, how they fit each other. Usually the upper jaw is in front and the lower jaw is behind.
Okay.
But if it's reverse or the lower jaw is too much behind, in such cases, if you visit an orthodontist early, they can correct this skeletal problem at an early age.
Okay. So I think it's beneficial to all viewers. They should know if any such problems exist.
Absolutely.
In recent times, we've heard so much about 3D scanning. So can you shed some light on how this helps you in your profession?
Absolutely. In fact, 3D scanner is the most in thing that you can call now in the industry. Uh, I think the most interesting part about a 3D intraoral scanner is you now don't need to take conventional impressions, mix a material outside mouth and put it inside, take measurement. Instead, a 3D intraoral scanner will capture all the dimensions of the tooth from a 3D aspect, and it will generate your intraoral scan. And for my profession, the best part is this 3D intraoral scanning will help me to formulate a treatment plan for aligners, will help me to assess what's wrong with the patient from a 3D point of view.
Yeah.
So I am absolutely loving my 3D intraoral scanner.
So it shows how much technology is advanced since the past few years.
Yes.
In recent years, there's been a boom in clear aligners and direct-to-consumer orthodontic products. So what's your take on these trends, and are there any risks that people should be aware of?
I'm glad you brought this question up. So let's first know what are clear aligners. Clear aligners are customized patient trays. They are thermoplasticized vacuum formed trays that are personally made for each and every patient, and basically they are a series of trays. So the patient has to wear each aligner for a week or 2 weeks and then shift to the next aligner, and gradually each aligner will move your teeth.
Okay.
I will never recommend any patient to get treatment done from a D2C brand. It's something like a delivery, a woman can deliver a baby in your house, but have you seen that? It's not recommended, right?
Yeah.
Why to do that? It looks cool in movies, okay, but trust me, in reality, always trust a specialist, because an orthodontist will guide you whether aligners are possible in your case, whether they will give predictable result, what would be the duration, what type of movements the aligner will be able to track efficiently. These are some questions that are best answered by an orthodontist. So I really urge everyone never to fall in the trap of D2C.
Okay. So you should always trust the experts on this.
Absolutely.
I've learned a lot about biofilms in biology. So how are they related to formation of plaque in teeth?
So plaque is also a biofilm which is functionally and structurally organized.
Okay.
So what happens when you don't clean your teeth? Microbes accumulate and adhere to the tooth surface. They colonize and they produce a matrix. And because the bacteria are inside this biofilm, that biofilm is more resistant. That's how the plaque is formed.
Okay.
And if you continue ignoring this plaque will calcify and turn into calculus. So always it's recommended that you go for a 6 month or yearly checkup to a dentist just to know whether you have plaque on your teeth or not.
Okay. Interesting. I think that's really helpful for everyone. So you should brush regularly too. Dr. Karthik, thank you so much for sharing your expertise and giving us a behind the scenes look into what truly goes into creating beautiful and functional smiles. And for those listening, if you ever considered orthodontic care or have questions about your own dental journey, this is your sign to take that first step. See you in the next episode of BioGenie, where science meets everyday life. Thank you so much and bye.